We're doing a little COVID today. I was online and I was watching some shows during the week, and I got a little upset. And so I decided to kind of rebut in my own way. I'm not going to get into the specific people that upset me or so on, but I'm calling them the Pulp Fiction Club because they don't pay attention to science. And you know, there are a lot of people who come, they're kind of into conspiracy theories, and they think everybody's out to get them. And the virus had to come from a lab; it couldn't have come from the natural world. And it's crazy, and there's lots the misinformation. It's hurting people, and that's what really upsets me. This is a real, genuine pandemic, where people die. And if not enough people are dying to suit some people, I'm really sorry for you. But I don't need a number. I only need like one to die from a disease to know it's a bad thing. So one thing in my mind is I push things to the extremes and say to myself, what if something happened like the Delta variant came out that was super deadly? What measures would we accept under those circumstances? And really, are we in a position to accept fewer measures now? I don't think so. That's my position. I'm the science guy, and I'm really sick and tired of misinformation causing people not to get vaccinated. I'll go off a little bit more here. I grew up. Well, bad thing to say, but there was a time a long time ago when people had polio, and you'd go to school and there'd be some kid in the back or in some kind of wheelchair, and that's the way they spent their life. And the polio vaccine came out and just revolutionized medicine, and modern medicine is keeps everybody alive till their 90s. It's over. Modern medicine actually, has overpopulated the world and gotten us kind of into this fix with the environment. Nobody ever talks about that, but it's the consequences of people being healthy and reproducing without any limit. And I didn't really expect to go off like this right at the beginning. So let's talk about what I'm saying is, I was watching a show, and the claim was made that the virus is not protecting people. And the facts is, I watch Dr. John Campbell in Britain quite a bit, and that's where I get a lot of my information from. And it's been very clear that the virus, that the vaccine works. Now, it doesn't work as well as we like. It's never been more than 90% effective. So, if you get the vaccine, there's a 10% chance, you may still get the the virus if you're exposed. But how much has the Delta variant, the claim that it does not protect you is just false. And it still protects even now with the Delta variant at about 80%. And the American data was slow in coming out, but actually this week, if you look at that headline, new COVID-19 cases and hospitalizations among adults by vaccination status, New York, May 3rd, July 25th. So this is the American data that's been lacking about that tells how effective the vaccine is. And we'll be getting back to that. But first, let's just cover kind of the things that have been upsetting me and what the Pulp Fiction I call club has been covering, and their sky is falling things. So let's go on to the next slide here and talk about one of the things that is interesting. Okay, so here we got here I want to actually click this so I can read it myself. Here, yeah. Okay, one of the things that was put out in a report was that there was this cruise ship, and everybody on the cruise ship was fully vaccinated, which is true. And it was it obviously was something with the cruise industry trying to do something to try to get the business back, an experimental thing. I don't know much details on it, but basically this cruise ship sailed at 30% capacity. And I had to look up this information. None of this was in the news reports I read. And so that comes out to 641 people. The Celebrity Millennium, the ship is the oldest in the fleet. And that 641 does not include staff. Everyone is fully vaccinated. And 2 people came up with COVID. Now, meaning that they tested positive for COVID, because obviously everybody's being watched. It's a cruise ship, it's an experiment. So 2 people fully vaccinated came up as being exposed. Now, here's the interesting thing. They were both asymptomatic, which means they didn't really have it. They were exposed to it, and that was detectable. And so they were quarantined. Anyway, the representation in which I call it by the Pulp Fiction Club was that, oh, the vaccine does not protect you. See some people on a cruise ship caught the virus. And that's how it was put out, people on a cruise ship. And well, if you dig into it, yes, 2 people who actually are asymptomatic have been quarantined in their cabins because they tested positive out of 641 people. And we knew the virus was never more than 90% effective in the first place. So this is a non-story, much ado about nothing. But that's the kind of thing that has been going on. And well, let's have a little fun. We've got go ahead and play the 2 videos there. Amos. That's the ship horn. Well, and here's the other one. Just the vax, ma'am. Just the vax.
Yep.
Get the vax.
There's a lot of misinformation, partial information, and I take a close look at a lot of these things because I don't want to misrepresent or go with something just because I was discounting the source. So I truly look at these things, and a lot of them. I've been looking at right-wing media, and that's another thing about this whole thing became so politicized that it's just ridiculous. The amount of politics in that is absurd when you think of something that should be primarily a matter of fact and science, but that's not the case. Well, we have politicians taking advantage of it and not in the public interest. In these media, right-wing media, all kinds of YouTube channels and stuff are kind of promoting it, playing it, not understanding quite what it means and making faces like, oh, here, see? So it's kind of frustrating to watch. That's not to say that there is no valid concerns of people who are worried about vaccines and stuff. And I don't think this is something that we can kind of brush under the carpet or anything. I think those things have to be addressed by providing information, even if it's not like a simple to follow, simplified information. I think it needs to be out there. The discussion has to be there, and they have to understand the risks of waiting for COVID to strike versus getting a vaccine. So that's my 2 cents, and we're gonna cover some of that. We're gonna have a special segment next week with a professor from University of Pennsylvania. I'll talk about it a little later, but that's going to be our topic for a whole segment.
Yeah, and my position is people act like this is serious. What happens if the next variant is super fatal? What would you do and what would you accept? Because that's what you should be doing and accepting now.
Yeah.
Oh, yes. So this tickled me. So Dr. Valentine will no longer see patients that are not vaccinated against COVID-19. It's kind of hard to read. And so I made a kind of this double picture and I actually removed his finger from the picture and, made the double slide there. Yeah. So there's a doctor in Alabama who is as fed up with things as I am. And, now the southern states have been very slow to vaccinate because they have some very conservative politicians running the show. And, one sad thing this whole pandemic has taught me is how much people follow idiots. I mean, they follow authority blindly is the nicer way to say it. And, Dr. Valentine, he went to medical school. He's been practicing for 20 years. He's not trying to hurt people. And he sees this information, coming out that you shouldn't get vaccinated. And so this is his reaction to it. And I expect him to stick to his guns. I also expect him to have a drawer full of vaccines. So if you actually do show up at his office with something serious, he can jab you and treat you, because that's I don't think he's going to put himself in an ethical quandary. I think he's just making a point. And it's a point that needs to be made. All you people out there who are anti-vax, I have a question for you. Where are you going to go when you get a heart attack? Where are you going to go if you get in a car accident? Where are you going to go if you get cancer? You break a leg, somebody you love gets something that's serious. Where are you going to take them? So now all that's fine with you. You believe in modern medicine, but somebody tells you, this came from a lab or something, or it was invented 20 years ago. We got patents to prove it, or whatever nuts bullshit they, see some angle that people want to exploit. This is a public health emergency. It really is. And we should be acting that way.
And Jilly, I have come across the David Martin thing. I'm still looking at it. I think that there is an issue there. I don't think that this is a smoking gun the way he's presenting it. And it's easy to follow that kind of narrative, but it's because we don't quite understand how patent law works and what
well, that's for sure. I actually have a patent. Amos, I have a patent. A company I worked for, I had an idea and they had to run out and patent it. And I also applied for one on my own. So I have a little bit. I am not an expert by any means, but a little bit of knowledge on the subject. And one thing you want to do when you write a patent is you write it in such a way you cover as much as possible, because this is not a scientific document. There's nothing that has to be proved scientifically at all. Yeah, I worked for one company where they used magnetic fields to communicate information from a device in the ground to a receiver above ground. And they went through great pains not to write it in terms of electromagnetic radiation, that they were only detecting magnetic fields. And it was a trick on words so that they could patent their application and not have it interfere with other things and cover as many bases as possible. So if you are a biochemist and you are applying for a patent on something, you are going to be told, you're going to do your job and you're going to give it to the lawyers and they're going to come back to you and say, hey, what about this? And it's a back and forth thing. And by the time it's done, a good patent, whatever that, if there is such a thing, it will cover as much ground as possible, so that if anybody comes along and with any kind of claim in the future, you might be able, that threatens you, you can defend yourself. And as far as the legal game and convincing the people that actually approve the patents, that's the game. You just get it approved, because the legal claims that comes later in the challenges. And a lot of the patent challenges never, make it to courts because it's a money game. Like we have a patent, like a corporation A says corporation B, we have a patent on this. You need to pay us, we need to kick us back some, or we'll take you to court. Well, court's expensive for everybody, so it all gets settled, through these agreements. And I think it's charlatanism to claim that patents really prove anything. They're nothing more than a legal tool. And Dr. David Martin spent a whole bunch of time, setting up. So I watched his tape. I watched what he was doing. And I think he was doing something which a lot of guru type people, people who get followers, and they spend a lot of time cultivating and getting you in a certain frame of mind. And I watched him do it, and that's what he does. And so by the time he gets to actually using his patents to try to prove something, he's sitting there with his bow tie, and he's established a certain rapport and credibility with you that really is not deserved. It's only that he's taken up your time and he's been smiling at you. And, that's what I think. I have no respect for somebody who's trying to prove something through patent applications, because I know how they are written.
And we've discussed that between us privately, and I haven't yet completely ruled any of this out until I really deep dive into the documents and stuff. But it appears to me on the surface even that he's actually saying two contrary things. On the one hand, he's saying there's nothing novel about the virus, and on the other hand, he says there's been patents given to things that are new with this virus before the virus has supposedly emerged. So on its face, there's already a contradiction in his claim, and maybe we'll do a little bit more about that in the future if there's any point. But to the point of human love and solidarity, in fact, yeah, what does that matter? Is the origin really what matters? I mean, of course, if there was any foul play or corruption, we would want to rectify it, but we are right now with the problem that virus is a real virus. People are dying from it. They're getting sick, and it has to be addressed. It has to be treated.
Hospitals are packed. You can, if you get in a car accident right now in certain parts of the country, you're in trouble.
Yeah. Yeah. So we will continue to follow this story. There was something else about the CDC here that you.
Oh yeah, getting back to the report, because when I put this together, I wanted to go off in the Pulp Fiction Club, and and what I'm saying to them is, if you got a claim to make, back it up with solid proof, not just something that you heard on something. Yeah, back it up. So anyway, getting back to the CDC report, this was their conclusions, and the vaccine works. It's our strongest tool. It's not the only tool, and by itself, it will not end the pandemic. But we should encourage people to become vaccinated, because it does help, and that's basically what the report says. And it documents that the vaccine was 90% effective to start with, and the Delta variant has made it so it's less effective. And part of what's maybe going on there is a time issue, where the vaccine only gives you protection for, say, 8 or 9 months, and then the protection starts to wane away, so that a booster may be necessary as a scientific fact, not just because the drug companies want to make money, which I'm sure they do, but because it actually works. And the evidence for that is Israel, where they have been having a higher number of people showing who have a vaccination history who are coming down with COVID. But then again, Israel was one of the first countries to become fully vaccinated. So they are kind of maybe overdue for a booster, if that's what's needed. And then you added this one. So what do we have here? I think this one just repeats the conclusion from the previous slide, where we need a multifaceted, multi-component approach, where the virus is one tool. It's an important tool, and it's not the only one. One of the most important things to do is wear a mask, because, and that's another thing. People, goes right through the mask like it's a chain link fence in a ping pong ball or something. Well, if you made a mask out of gauze that you could see through, it would still have a certain beneficial effect, because it would diffuse the airflow. So, something is better than nothing. And why does a mask have to be perfect? That's nuts. All it has to do is protect well enough to make the virus go away, so that enough people wear it, the virus doesn't meet enough people to keep going, because all these masks are in the way. You can get around a few, but not enough. And so that's another thing that really irritates me is the whole talk about how effective they are. They are effective, period. So use it. End of story.
Correct, and I think that that's kind of silly that they're like posing this as a matter of personal freedom. How difficult is it to wear a mask? If this is something, I mean, it doesn't cause you any physical ailment or anything. I can understand maybe there is some points to be made about social development in kids, but seriously, guys, it's not so hard to have a mask on that it's such a human sacrifice. But it is what it is. It's the political spin on it is rampant. Here's
People
one.
say it's about freedom. To me, I don't think they know what freedom really is. They
Yeah,
never had it taken away from them to find out what it really is, because it's not being able to walk down the street without a mask.
yeah, yeah. And here's a cartoon about the vaccine uh, aspect. The Regeneron, and that's another thing that's been happening. There's a lot of talk about all these potential cures. There are actually some cures that they're working on that are promising in principle, and I think they're going to be playing a huge role in the future. For example, there is some peptides that they're working on putting on the top of splicing them on antibodies so that they would interfere with a mechanism of attachment for the virus to the cells. That is one way of treating it, in that if that proves successful, that could be very effective. It's not a vaccine; it's really treatment, and that there's another one in Israel that's been showing a lot of promise so forth in clinical trials. But some of these other things that are like Regeneron and what is it, inter something, and
Yeah, it's
uh,
hard to say.
yeah, they show some uh, some effects in preclinical trials. That means like you test them on mice or whatever, or in a test tube, and there's some effect, and people are jumping on that like that is the solution for everything. We don't need vaccines, which is not the case. So everybody has to be patient with these things, because these things unfortunately take time. Um, and
If more people were patient, it would take less time.
Probably, yeah. Here's another cartoon of anti-vaxxers actually using their kids as pawns.
Yeah,
It
yeah, I heard
is.
that this week too. That was also upsetting.
Yeah, we'll see what happens. This is an ongoing story. I don't think we're gonna be rid of this virus for some years, unfortunately, and so we'll keep tracking it.